The Ibrahim Traore administration in Burkina Faso have accepted $147 million healthcare aid from the Trump administration in the US. The terms of this deal contains provisions on disease surveillance and other data sharing provisions that cause countries like Zimbabwe and Zambia to flag the deal. So why is Ibrahim Traore taking this deal? I will explain for you on this channel. My name is Nenebi Tony. I'm a Ghanaian writer who lives in the US. On this channel, I like to get into the facts and stats of the matter. So subscribe if you like intellectual conversations. Now, let me read you some lines from a press release that was put out by the US State Department. I'm reading just 3 lines. The United States and Burkina Faso signed a 5-year bilateral health cooperation MOU that reinforces regional health security in the Sahel while advancing Burkina Faso's capacity to independently manage infectious disease threats before reaching our shores. So this deal is about the US protecting its healthcare interests. Number 2. Through this MOU, working with Congress, the Department of State intends to provide up to $147 million over the next 5 years to support Burkina Faso's effort to combat HIV/AIDS, malaria, and other infectious diseases while bolstering disease surveillance and outbreak response capacities. So this money will be used for disease surveillance and other outbreak prevention capacities. And then the third line is the MOU allocates approximately 12 million to global health security initiative that strengthens community health system, improve and digitize data reporting, and build laboratory capacities to detect potential pathogens. So, as you can see, data collection and other forms of disease surveillance are involved in this package. So now, what is disease surveillance? Disease surveillance is a way of protecting public health through collecting and analyzing of data related to diseases. And how disease surveillance is done can be ethical or non-ethical. It can be ethical that maybe there's an outbreak of, let's say, Ebola in Liberia. People who are researchers would get into collecting Ebola-related data, maybe the people who died from Ebola, the people who were affected by Ebola who lived, getting some of the Ebola virus and taking it to the lab and analyzing it and see how Ebola can be prevented in future. That is a way it can be done ethically. Non-ethically, I'll give you an example. In the US, there is something called the Tuskegee experiment, where researchers affected African Americans with syphilis. Yeah, they put syphilis into the bodies of African Americans so that they can analyze how syphilis affects them. That's unethical because the people were not sick, you made them sick. You understand? So, disease surveillance, I'm trying to say, it's not a bad thing in itself, but it can be bad when used badly, right? And so, the reason why this is important to this conversation is this. If you've noticed the lines I read from the State Department press release, disease surveillance, data reporting, and laboratory capacity is very, very important to the deal that the US signed. So basically, the money the US is giving Burkina Faso is going to be used by the US in Burkina Faso to study diseases, right? The US does this all the time. The US spends about $900 billion every year on research and development. So that is not bad in itself. What is bad is how they are going to do it. So number one, they are going to digitize data reporting. So the US is going to build a digital portal for health data in Burkina Faso. And if the US is building it, who don't you think that they're going to have access to it? Remember when China built the AU headquarters in what do you call it? Ethiopia and Baghdad so that they can spy on us? Yeah, it's possible that the US can do this in Burkina Faso. And that is why it is dangerous that he took this deal. Number two, we are getting to why he took this deal. He took this deal because he needs money. You can say all you want about standing up to Western power structure, but governance is not about words. It's about your ability to solve problems for people. And as it stands now, Ibrahim Traore have not demonstrated that he has the capacity to independently solve the problems for Burkina Faso. And I will give you examples of why I'm saying this. In September 2023, Ibrahim Traore entered into an IMF bailout program. So, for the past 3 years, Burkina Faso have been under the management of IMF, coupled with the fact that Ibrahim Traore's Burkina Faso's monetary policies are still subject to the France agreement that Burkina Faso have had all these years. So the economy of Burkina Faso is still essentially being managed by the Western power structure. There is that. Number two, from summer 2025, which means that from July 2025, the EU came to a conclusion that boxing out Ibrahim Traore's Burkina Faso from their initiative in Africa was not good for the security of the EU. Why? Because terrorism is only growing in Burkina Faso under Ibrahim Traore. So last July, EU gave Burkina Faso 80 million euros and entered into another bilateral agreement with Burkina Faso. So again, Ibrahim Traore's Burkina Faso have been in bed with the EU for about a year now. And the third one, the US. So following the EU model, the Trump administration came to the conclusion that the rise again of terrorism in the Sahel region is a threat to the US. So they had a special envoy go to the Sahel countries to try to open relations with them again. And it looks like it's already yielding fruit because they've already given Burkina Faso money to start medical surveillance in Burkina Faso. And he accepted it. So, yeah. So I'm saying this to say this. Nigeria and Kenya have also accepted similar deals from the Trump administration. And as a result, people are calling Tinubu and Ruto CIA spies because they are allowing the US to spy on their people. So, now that Burkina Faso have also entered into the same deal, is Ibrahim Traore also a CIA spy? Was he a CIA spy this whole time? I'm laughing because anytime I say something negative about Ibrahim Traore, a lot of people by comment call me CIA spy, Western puppet, French puppet, my brother. If I'm a CIA spy because I'm speaking against somebody who is standing up to Western powers, and the person who you claim is standing up to Western powers is doing deals with these Western powers behind your back, isn't he also a CIA spy then? Anyway, seriously though, this is my way of trying to highlight hypocrisy in Africa. On this channel, one thing I try to do is explain how global politics and foreign policy is not about emotions. You can talk tough all you want. When it comes to governance, you need to understand that we are not in an island. The best you can hope for your leaders to do is to not enter deals that would be negative for your country. I won't say that I don't want the president of Ghana to do deals with the US. I live in the US. I would like the US to have a good relationship with Ghana, right? What I will want is that any deal the president of Ghana enters with the US would benefit Ghana. The US will ensure that the deal benefits Americans. The president of Ghana is supposed to ensure that the deals benefit Ghana. So, I'm highlighting this, and I'm going to be highlighting more and more deals like this because from what it looks, Ibrahim Traore is no longer a pariah, so Western powers will be doing more and more deals with him. So I'm going to highlight these deals and make you understand that he is just like every other African leader. Talking tough and appealing to the emotions of people, but not entering deals that benefit his people, in my opinion, the most important ways. Zambia, as we speak right now, is renegotiating the same deal with the US. The US offered Zambia $1 billion for the same deal, and they turned it down. And the US is negotiating deal. What I think is going to happen is the US is going to reduce the money for Zambia, and Zambia will probably enter the deal with terms that are more favorable to it. I don't care about taking money from the West. It's about the terms. And as you have seen from the portions I've read from the press release, medical surveillance is happening. Disease surveillance, data reporting is happening. And are we comfortable with that? You tell me in the comments. Are you comfortable with that? My name is Nenebi Tony. I'm a Ghanaian writer who lives in the US. Subscribe if you like intellectual conversations. We'll talk later.